most famous physical therapist on the internet.
Oh,
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
And my opinion is the one that matters, right? Today we're going to talk about stop finger joint
Why,
pain
Bob?
in minutes. Motion is lotion self-treatment. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to bobandbrad.com because this week we're giving away the Teeter LT Freestepper. LT1, I believe.
Which is like a recumbent bicycle or a recumbent elliptical.
Elliptical, yeah. Elliptical? All right. So really nice device. This is a $700 device. So go to Bob and Brad, go to the giveaway section, or go to Facebook. It'll be pinned to the top of the page of the contest. Go to Instagram, Twitter, or TikTok if you want a 60-second version of Bob, if that's all you can put up with. Bob and Brad.
Right. Bob, finger joint pain, very common. Oftentimes from arthritis, rheumatoid arthritis, but also from, after an injury and you're trying to get things moving again. One way or another, if you want to manage pain, get them more functional, you've got to get them moving.
Yeah,
that's like in the title, motion is lotion. As if you're going to put some of that nice lotion on there and they feel better so you get moving. Well, it doesn't always work that way. You actually have to get them moving, and that's what we're going to show you.
Well, you get more blood flow to the area. It helps it heal better if there is injury. But
the synovial fluid in each joint.
Yeah, they found out that arthritis actually gets worse quite often with no movement. People think like, well, it hurts, so I'm going to just splint it and let it rest.
Right.
And it actually gets worse. Hard to believe.
Yeah, I mean, if it's so bad that you can't move at all. But typically, as a matter of fact, I'm babbling on here, so just fast forward.
No, he's correct, though. Arthritis can get to the point where it's so bad, you just can't even move it.
Well,
anymore.
I'm going to tell the story, but just fast forward. I just had a friend. He had a heart attack. He was in a bed because he had and he's fine now.
Sure.
But, they put the scope through the femoral artery.
Sure.
So he was in bed for a day and a half, could not move that leg. He had mild arthritis, didn't really bother him. After that, no motion for a day and a half, he was using crutches.
Yeah.
It took him a week and a half of movement, and now he's fine again. He's a farmer, and he's out farming.
I've heard this story many times. I mean, I've seen this story many times.
So, okay, now we'll get back to the video.
Okay.
So finger motion. So particularly in the morning when you get up and you have those fingers, I experience this myself, especially my right hand. If you cannot make a fist, they're so stiff, you got to get them moving. Yeah. So the first thing you're going to do is just, you don't have to hold them out, but get your hands out and just open and close fists.
Gently open and close.
Yeah, you don't have to go, just go to the point where they stretch a little bit. And, you're not going to be able to go fast anyways because it's a little uncomfortable. But don't get too alarmed about it. They'll loosen up with time. 10 to 15 repetitions is probably going to be enough. But then add this. Make sure when you close them, take the other hand, go over the top, and give a little overpressure to get that full fist if you cannot get all the way in. And, just kind of work it. Not too aggressive. You don't have to create pain.
What's nice about this, you're hitting all the fingers at once. Basically.
Exactly. Precisely, Bob. And that's kind of a comfortable thing.
Yes, it is.
In general, you got that full wrap around your fingers. And, obviously make sure you do both hands. And I think a lot of times probably people do have one hand that's a little stiffer than the other.
Often their dominant hand.
Yep, exactly right. If you had an injury, usually that finger, like I have one finger I injured, and that one's definitely stiffer than the other. Yeah. Well, you got that.
Oh, Dupuytren's.
It's getting better, though.
It is getting better.
Then the other thing, don't forget, go like this, like you're going to say a prayer, and then go and stretch them the other direction. You don't want to just go this way. You want to go both directions, flexion.
Because quite often I see people with arthritic hands, they can't straighten any more than this.
Exactly.
And you really want to stay ahead of it. Yep. Actually, the pain levels tend to go down if you gain a little more motion.
Yep. And it's probably not in one day. If you haven't done this for a while, give it a week or so.
This could take a long time, actually.
Okay, then we're done with that. Next thing is to do range of motion in each individual phalange joint. In other words, the joints in each finger. I'm just going to go through one finger.
Right, and I don't know if you necessarily have to do it if the hand is fine.
Right.
If one of the fingers is fine.
Yep. Yeah, if you got that problem finger, like
Yeah,
mine
that's
is
where
my
you-
third digit,
Yeah, that's where you want to spend the time.
right? And it actually works good. I don't have it. Oh, I'll use this.
So what he's going to do is he's going to apply the stress to each joint.
Yep. Can you zoom in on this?
So first he's at the what we call it, the distal
Yeah, the most distal.
MCP.
Yeah, phalange joint. And so I'm pinching not over the joint, but before I get to it. And I could go like this, and then can you see that, Liz? I'd have to break this finger off to make you see it better. So I'm isolating that joint. And I've had people with injuries, a broken hand,
Yes.
and maybe their hand got semi-crushed or whatever. And then I'll have them go through each joint over the edge of a table, and oftentimes like this, so you get that full range down all the way to straight. And then the MCP joint, we call that the first one there, your big knuckle. Grab a hold of it before the knuckle, bring it down and up. And you can do some rotation on these. And that can be that can be like the trick that, oh my goodness, it loosens right up. That's a little trick.
You can even do a little rotation and then bend it.
There
even
you
a little
go.
bit.
Exactly.
And try different ways. Rotate it this way.
Yeah.
And if it increases the pain, don't do it.
Right.
If it feels better, do it.
Right. If it hurts at first and you move it and it's like it breaks
Right.
loose, then you're fine. If you haven't done this before, don't get too aggressive the first time because it might get sore the next day. So be gentle with it and gradually work into it.
So one thing you were going to talk about, putting heat on it before.
Right. If you
So-
respond well to heat, let's say you're doing dishes and your hands feel better, looser after a shower or a bath, and you really want to get some deep heat in because water feels good, but it'll go about skin deep.
Right.
And your conventional hot pack, if you buy it off the countertop, that costs about $30. They'll go skin deep. It feels good. But if you want to get into the joint, you're going to have to use far infrared
heat.
So if you're interested in that, we really like this. Bob and I both use one of these.
We use it primarily on our backs.
Right.
So,
But
we-
that's a nice one to get. And there's a reason for it. It works really good for your hands because you can make it into a muff.
And the thing about far infrared heat, it actually penetrates. So again, regular heat, only maybe a millimeter or so, just surface.
Yep.
This goes 2.36 inches.
Right.
So imagine that. That's going to easily go all the way through the
Yeah.
joint of the finger.
Your fingers will get warmed up.
Yeah.
And it's not aggressive heat. You're not
No,
gonna
not at
burn
all.
yourself. And
A lot of times it almost doesn't feel like it's
exactly right. When you first put them in, you'll say that doesn't feel like a hot pack. It goes to about 104 degrees, which
Yeah.
is therapeutic.
But it'll go all the way through the hand too.
Right.
So that's what's nice about it. It's and then you can, if you get like the platinum one, which is this one is, you can use it all over the whole body.
Right, you can use that on your back. I mean, right now you can easily do both hands at once. It's going to get
Yeah.
full penetration. And then, if you've got a knee issue, you can wrap it around your knee. You could put it on your back. And they're just made they're expensive, but this is the kind of thing that's
They
going to
are
last
pricey.
you a long time.
I
They're
got
built
one.
well.
I got one for my aunt who has fibromyalgia
Yeah.
because again, it's one of those things where you get pain in a lot of different spots.
Yep.
And it's versatile
And
and
she-
it's deep.
She's grateful.
I hope so.
Yeah.
Try to be a good
You
nephew.
Trying to get some inheritance or what?
No, I don't know. Are you kidding? Well, I don't. think
Just
those
kidding,
terms-
Bob. Just kidding. Let's carry on here. So good luck with getting those hands loose. Oh yeah, by the way, do these exercises in the morning. It's a good time, but you can do them, a couple,
Throughout
3
the
times a
day.
day if you'd like to.
Yeah, you really can't almost do them too much.
Right.
I
right.
mean, you can really make it part of your routine. That like if every hour or so, especially if you work at the computer
Right.
net, to take a little time and just do some of these
Right.
can help make a big difference.
I do want to say one thing, Bob. Now I'm babbling, but this is a true story. I was watching a video on apple cider vinegar, and I thought,
Right?
I wonder if that would be good for my hands.
This is
the truth.
This is the truth because I witnessed this.
I woke up in the morning and I could not make a fist with my right hand until I did these exercises.
and that was going on for quite a while.
Yeah,
I
it had
remember
been
you
a couple
complaining
years,
about it.
right? Couple years, and I thought, well, I'll do 2 tablespoons with a little water, and I did that every day. And after 2 weeks, I started to notice less stiffness in the morning, and it's not 100% gone. And actually, I cut back on it because I kind of forgot about it.
Sure.
So I don't take it every day. I take it about 2 or 3 times a week now.
Sure.
And so,
But it was, I mean, first off, there's research that shows that works.
right.
I mean, that's
I
not
didn't
just
find a
some-
lot of it, but there's some.
Oh, I saw some.
Well, it's
Didn't
not.
you?
It's not like, you know,
Solid.
it's not like how much research they do on eggs and
Yeah.
heart problems. But yeah, but no, I'm saying it's. I don't believe a lot of research, anyways, Bob. You know that.
But there was some research.
Yeah.
That said, and
There was enough for me to believe that there's some science behind
Yes,
it. It's just
yes.
not snake oil,
right.
you know, and it's
right.
safe. You dilute it out
It wasn't
enough.
the placebo effect. for
Right,
you. So, but,
exactly.
you know, what a great thing. By the way, Brad and I can fix just about anything.
Except for
A broken heart.
there you go.
There's no research on that either. We haven't figured that one
We're
out.
going to get some though.
No, thanks.